Hello everyone, welcome to the first full episode of With You in Mind. My name is Sarah Bullock-Chase and I'm joined by my co-pilot Lisa Upton. We are the co-founders of BrainBuddy and together we're going to be your podcast hosts. Now, before we get started and introduce you to our guests, we would like to give a big shout out to our sponsors, the National Brain Appeal, who are the supporting charity for the National Hospital for Neurology and Neurosurgery in London. Let's cue that jingle and get our first episode started.
Oh, we're so excited to be here recording this first series. We've got some special guests for you today. We've got neurologists Matthew Walker and John Duncan. And we're going to be discussing with them how COVID-19 over the last year has really disrupted some of the valuable work at the National Hospital. In addition to that, Matthew and John are going to be sharing with us how there is light at the end of the tunnel and how we can expect to see surgery and clinics resume sometime in the very, very near future. But I think, you know what, before we introduce the guys to you, a little bit more about them because their CVs are so impressive, right, Sarah?
Why, yes, indeed. Well, Matthew Walker is a professor of neurology at the Institute of Neurology, UCL, and a consultant neurologist at the National Hospital for Neurology and Neurosurgery. He specialises in epilepsy, neurological sleep disorders, and video EEG telemetry. He has various roles within a range of organisations, from brain to epilepsy research. John Duncan, he's also a consultant neurologist at the National Hospital for Neurology and Neurosurgery. And as well as his general neurology expertise, he has a particular interest in epilepsy. And with much of his research activities directed at imaging the brain to demonstrate both the structure and function of the brain and their abnormalities in various forms of epilepsy. Since 1998, he has been a medical director of the National Society for Epilepsy and professor of neurology at the Institute of Neurology of University College London.
So thank you both for joining us. It's a pleasure to have you here today, joining us on our very first podcast. So I think if we just start with the question, it'd just be really interesting to know how it's been for you both over the last few months, both personally and I guess from a professional point of view in terms of being pulled onto the front line and seeing the reality of...
So it's been incredibly busy over the last few months. And I and many colleagues have volunteered to help on wards and the intensive care unit. We've, of course, not particularly qualified to do the heavy duty intensive care decisions, but been there acting really just as help, either liaising with families, helping lift and turn patients on the ITU or taking bloods and helping out really with the nursing staff and the doctors. And it's had a number of effects, one of which is just absolute admiration for all that the nurses and the ITU staff do. I mean, I can't speak highly enough of what they do, the hours they put in and the stress that they're under. And it's been nice to be able to help colleagues during this difficult time. In terms of our day-to-day work, obviously everything seems to have gone virtual again, and that's difficult because I very much miss the patient contact with patients, especially when seeing them for the first time. It seems very artificial to be seeing people over a video screen when it works, or worse, by telephone. And you often miss, I think, quite a lot of the nuances, and I think it has a detrimental effect on the communication between doctors and patients. So I'm very much looking forward to getting back to seeing people in face-to-face clinics. On a personal point of view, I've taken full advantage of the COVID experience. I've been vaccinated. I managed to get COVID. I've had to self-isolate. And I think I've done almost everything apart from deliver Amazon goods. So it's been, it has been a stressful time. And I think the other thing really that I'm beginning to notice is that it's been a very, very long year. So it's not been much opportunity for taking any breaks. I've had very little in the way of breaks or holiday over the last year. And I'm just beginning to feel a bit tired and jaded, and I'm just very much looking forward to this ending, to the whole of this ending. I mean, I think it's been enormous stress for many people. It's been an enormous stress for many of my patients, and I've been in contact perhaps with my patients more so than I am at other times, because many of them have found it incredibly difficult. On the other side, some of them have found it has had its advantages. So for some people, it's meant more flexible working hours and seems to have meant less stress. So it's not been all bad for people, but it's certainly generally been a very stressful time.
And I think a lot of people will share with you the views in terms of we're only at the end of February, but my goodness, it seems like we're almost like 9 months into the year, doesn't there? But hopefully some light at the end of the tunnel, which we heard yesterday with Boris's announcement. And
yes. Well, the number of patients at our hospital at UCLH with COVID has dropped off just dramatically, and dropped off very rapidly. And that's obviously a combination of the lockdown and also the vaccinations. There's still quite a large number of people in intensive care, and that's because there's a bit of a lag. But in terms of patients on the ward with COVID, that's very much better. As I say, I'm really looking forward to seeing my patients on face to face rather than having to speak to them over a telephone line that often fails. And again, there's always good and bad. I think it's meant that some patients who live a long distance from the hospital have been able to more easily, communicate. And it always seems to me difficult if you come from miles and miles to outpatients where you sit and wait for an hour or something for your appointment, and then see me for 10 minutes just to tell me that things are going well. So for a number of patients, it's obviously has its advantages, and I think there will be a change in practice. I think we will start to do more virtual consultations when it's possible, and when it's to the advantage of people with epilepsy. But as I say, for many, I still miss that face-to-face contact.
Definitely. And John, how have you found it?
Yeah, as Matthew said, it's been a very difficult few months. I must say, the second wave was a lot actually worse than the first wave in terms of the impact on the hospital. I think we tried to keep things going as long as we can and could, because of course people with epilepsy were being sort of not ignored, but they were kind of prioritised out of the acute system. So like Matthew, I worked quite a lot on the COVID wards and in high dependency, trying to help out, which was a very steep learning curve. And I think sometimes we may have been more hindrance than help, but everybody was very nice and I think really able to help shoulder the load. I, for one, was way out of my comfort zone, doing things that I'd never done before. But in a way, you could say a change is as good as a rest. I wouldn't put it quite like that, but looking on the positive side, I certainly learned to do things I hadn't done before. I learned how to charge an electric wheelchair, I'd never ever done before, and I learned actually a lot more about how the hospital worked than I ever had in a managerial or in a consultant's role. So that was very humbling to work with a really great set of motivated nurses who really do all the hard work, and they were really fantastic actually. But as Matthew says, also I think the tide has turned, and the wave of the tsunami of the second wave is now going back. We have to now start picking up the pieces and resuming, trying to get business as usual going. I mean, it's really been severe. I mean, it's just over a year since the last epilepsy surgery operation. It was February 2020 was the last time. And we, of course, have us and our surgical colleagues, Anna and Andy, have a large number of people who are waiting for epilepsy surgery. And a lot of the follow-up appointments I'm having with people were designed to be 3 months after the operation. And the operations haven't happened yet. So it's a question of, keeping in touch with people, keeping their motivation up, giving them explanations as to where we are and what's happening. I think I've had 3 follow-ups today, exactly like that. People from all over the place, from the north of England, from Wales, from Northern Ireland and so on, who are rather in a holding pattern, waiting. All the tests have been done. But I think, things are beginning to get going. We've got 3 dates for surgery now in March. which is great. We've been able to resume our imaging research, whereby we're using imaging to try and make neurosurgery more precise. We had a patient yesterday and again today coming to Chalfont really for a whole day of scanning. So that feels as though these are the green shoots of spring beginning to take root. And so we're really looking forward to that. But we have to be cautious because whilst the vaccination program in the UK really has done well, and I think it's fair to say it's unusual to say this for Britain, but I think it's done better than any other country globally, which is a fantastic achievement. And we're really seeing the results of that with the numbers of sick people coming into the hospital, dropping right off. And whilst I think we still have, 35 patients with COVID in the hospital just now, these are people who've been there for a while, and they're either stable or they're on the recovery pathway. And what isn't happening is we're not being inundated every day with, as many new people who are deteriorating with COVID, as many and more than we could take, which was the situation until fairly recently. So the lockdown and the vaccination program have had a dramatic effect on this and will put us in a much better position to get back to business as usual. I think, though, people can't be too blasé about this. The coronavirus has not gone away. And if I see people who say, well, I've had the vaccine now, I don't need to bother about wearing my face mask. If I see these people in petrol stations and in shops, I have to resist the temptation to have it out with them, because I can see it probably wouldn't go well. But bearing in mind some of the people who one's talking to, but people have to keep their guard up, and this has to be a change of life. I think in the hospital certainly infection control really is to the fore, and actually there are some advantages to that, in that if coronavirus precautions are taken, that also gives defence against other kinds of hospital-acquired infections that people would always be potentially exposed to. So one of the, I suppose, fringe benefits of this COVID pandemic has been better infection control across the hospital. And I think that's something that will stay with us. I think so far as clinics go, certainly the delay for surgery has been a very difficult ordeal for many, many people. I think also for new patients, as Matthew has described, it's very suboptimal just doing it by telephone. I mean, by analogy, it's like being at Twickenham watching a rugby match or hearing it on the radio, hearing just the description. Okay, you get the big scores, but you lose all the nuances, and you miss the interchange between the referee and the players and so on. It's very much part of the face-to-face consultation. So I think for new patients, it's much less satisfactory. There are, however, some people, maybe people who one knows well, and there's a good relationship already, whereby if they come from a long way away, and it will be a whole day trip to get to Queen Square and back, and expensive as well as time consuming, that if the situation is fairly stable, actually a telephone appointment or a video is actually much more convenient for people. So I think that will stay with us. I think we will have more follow-ups done by telephone and by video for the right people. It will stay with us as part of our portfolio. In a way, it's like the analogy. I mean, imagine, say, 40 years ago, one had to make an appointment to go and see the bank manager to get a loan. I mean, that would seem extraordinary doing that now. You do everything online. So I think healthcare is moving in that direction, and COVID has given us a huge impetus to do just this. So I think we need to keep the good bits of what we've learned from this pandemic, like better infection control, telephone clinics and video clinics for the right people. But also we have to get back to doing what we have to do and can do much better face-to-face. But I saw a gentleman in clinic yesterday by video, and he thought he had developed Parkinson's disease as well as his epilepsy. It's quite difficult doing an examination for that. You can have somebody walk across the room and see their hands, but without actually examining somebody physically, you miss a lot of nuances and aspects.
If anything, can both of you give us an update on any research that's been underway as well?
Well, it's been very difficult. I mean, a lot of the research I do involves patients coming to the hospital, and particularly people coming for brain imaging as a prelude to surgery. So that really has taken a big pause over the last 9 months. But I think we've been able to, by that enforced moratorium on seeing new people, it's actually given us this, looking on the positive side again, it's given us the opportunity and the bandwidth to actually reanalyze old data that had been acquired a year or two before. A lot of analyses that you wanted to do, but you didn't have time to do. So actually, there's been there's been some good come of that, and we've been able to write some new ways of acquiring scans with much higher resolution, which were used at Chalfont actually for the first time yesterday. Basically, so you can map the nerve fibers in the brain with a dimension of just about 1 millimeter, which is much better than has ever been possible previously. So I think that we've been able to do that kind of thing. So it hasn't been a complete waste of time in terms of research.
As John says, it has had an impact, and I do both clinical and laboratory research. And you'd think in the laboratory research it may not have such an impact, but of course, in the laboratories, people have to be separated by more than 2 meters. In fact, we've been running the laboratories initially just on 25% of occupancy, and now up to 50%. And so it has had a big impact on laboratory research as well. So research has slowed. But as John said, it does give you the opportunity to step back and think about, what you're doing, to reanalyze things that you've done. And we're planning for a big trial with a completely novel approach to the treatment of epilepsy, which is using gene therapy, where we can inject in a sort of vector into the brain that just modifies the excitability of brain cells rather than cutting them out or destroying them, with hopefully permanently curing people with epilepsy. And we've been working on that for decades now, and over the last year it has slowed things a bit, but it's given us the opportunity to sort out the protocols for the trials, to get a lot of the paperwork done for the trials, so that hopefully we're going to be ready once we come out of this lockdown to actually move ahead with the first in human trial of this therapy.
Wow.
So so there's always, I think it's always easy to sit and look at the worst possible side of anything that happens, but there are benefits, although I have to say the benefits have been small compared to obviously the devastation that the coronavirus has caused, but there have been some benefits from having this period.
And I think it's quite good to be able to see the benefits, the positives, things that possibly we've learned from all of this. And I mean, I think amazing doing this research, this gene therapy as well. So it's very interesting to hear more about other aspects, other things that are going on at this time.
Fantastic, guys. We talked a little bit earlier about the easement of lockdown in Boris's announcement yesterday. Can you tell us a little bit more about what that means for the national in terms of how clinics might start to resume, or when they might start to resume?
This hasn't really been translated actually into clinical detail. I think one thing is the telemetry ward at Queen Square reopened this week.
Okay.
So 7 beds of video telemetry, which is mainly geared towards people being considered for neurosurgery. That's now running again, having been closed since must have been beginning of December. So that's great. I think in terms of clinics, our epilepsy clinics have been pretty much running business as usual in terms of numbers of people, just rather than being face to face with video and telephone clinics. And my sense is that the plan that's in place that I think will get rolled out is that we will probably have a face-to-face clinic. 1 in 2 or 1 in 3 of our clinics will be that. So it'll be grouped up for people who you need to see face-to-face. And then there'll be telephone clinics and video clinics that don't need to be done in the outpatient department.
And for some people, that'll be the right thing to do, won't it? Like you said earlier, I think both of you touched on it. For some clients, it's the right thing to do through telephone, because you do have some people. I mean, I know myself, I used to come down to London on times, and it would just be, a 20-minute appointment and all is well. And there's no need to do that. We can do that by Zoom. But in other situations, we absolutely need the face-to-face aspect of it, don't we?
And some individuals are quite nervous. I mean, Chalfont's been running with video telemetry and MRI all through the lockdown period. I mean, Chalfont is much easier because it's a much more spacious site. That's been running. Well, numbers have been reduced, but it's certainly been running. But no, some folk are invited to come there for their appointment, even just for an outpatient scan, and they just feel very uneasy about that and want to postpone it. So I think we shouldn't underestimate the concern that some people have about going into a hospital, and they fear that they may contract coronavirus. I think they can be reassured that the steps are very rigorously in place to you can never take it away 100%, but to really minimise the risks.
Yeah, for sure.
I think as time goes by, people get vaccinated. I was talking earlier about people being a bit too lackadaisical. I mean, the other extreme, of course, that some people will find it so anxiety-provoking coming to a hospital, they may choose not to do so, even for months, even years to come. Okay. And that's a real concern, actually, because there's a lot of people, not only with epilepsy, but with other conditions, are probably going untreated with delayed treatment because of COVID, partly because of COVID taking over things, but also because people are uneasy about going to the hospital.
Yeah.
And that was very clear in accident and emergency, that both in the first wave and the second wave, the numbers of people coming to the emergency department with a whole range of conditions, from pain in the leg to chest pain or possible stroke, whatever, numbers were remarkably reduced. So there needs to be some rebalancing of that. But I think it's you asked how it's affected us. I mean, it's been traumatic. I think in a way, it's less traumatic for us than many people because we've carried on doing the job, and we've obviously you have to come to the hospital to do your work. You can't sit inpatients and face-to-face clinics are done. So I think it's been a much less impact for us than for people who either are furloughed and not working, or are entirely working from home, which must be really difficult for the course of a whole year.
Well, I mean, is there any information or advice, you could give those individuals who are waiting treatment, who are, within your clinics, anything to give them?
Well, I mean, we keep in touch. We keep in touch with people, and part of the job, in a way, is to give people more support. So tell them, and if we haven't cancelled appointments, I guess kind of put them online, so at least you can talk to somebody and say, that we're still here. The hospital hasn't been closed. Think of this as a pause rather than a stop, and no one's forgotten about.
Yeah.
And I think that last point's very important. Obviously we haven't forgotten about people at all, and I know that sometimes people sit there thinking, nothing seems to be happening. I was supposed to have my operation in April last year, and I know certainly some of my patients have been concerned that because they've missed that's it, they've missed it, but that's not the way things work at all. And the hope is that that it will be possible to perhaps even up the number of operations that we're doing, or to somehow deal with the increased waiting list, because I think that's the concern as well, is that it's not just people who have been on the waiting list now who obviously had to wait because we've not been doing surgery, but people in the future, because the waiting list will be that much longer. And so it's really, it's up to us and the hospital and the government to try and sort out ways in which that can be remedied. And it's not clear at the moment how that will happen, but I'm sure it will happen, because these waiting lists can't remain as they are.
No. And we know as well that waiting is a big cause of anxiety for lots of people. I wonder if there's been any extra support for people who have been waiting for surgery or appointments that they've not been able to attend.
Well, I mean, we have 3 fantastic epilepsy nurses. We have our secretarial team take many calls from people. We have obviously our psychologists, including our clinical psychologist, Sona Kawa, who's now part of the system. So there's a fair few people to take the calls. But of course, there are 10,000 people with epilepsy come to our clinics, which is a big number.
Wow.
Of course.
And sometimes, it is sometimes difficult to keep pace with the demand, particularly not only from telephone, but also from email contacts from people.
Mm.
Yeah.
And I think Sarah and I really miss that aspect of what we do with Brain Buddies, supporting people and just being there in person at Queen's and all the talks that we did last year. So we're really looking forward to, hopefully, fingers crossed, getting back to that at some point this year.
Yeah.
And my best prediction from that will be probably late June.
Okay.
And if things go according to plan,
Mm.
I think it's the 21st of June.
Yeah.
It's hoped that the kind of basically restrictions will be lifted, provided the recovery goes, without any hiccups. So let's fix a face-to-face Brain Buddy meeting for the first Wednesday of July.
Let's do it.
If you could say and give us just one thing that you maybe have learned.
I think it's actually been. It's like many things. One of the things is you learn a lot about colleagues, and I have to say, mainly very good things about colleagues. You've learned how resilient.
Moment I was worried.
And
For a moment I was worried.
No names. And how resilient the NHS is. It's really it's difficult to I think convey how impressive and admirable the response has been. I can't speak for all hospitals. I can just speak for the hospital I work in. Certainly with the second wave, things were well organised. There was an enormous response to asking for volunteers, and or colleagues seem to be doing incredibly impressive things and amounts of extra work in order to help get us through this. So I suppose it's like anything. It's like any disaster. One of the things that you learn about is both how altruistic and also how robust humans are. That has been sort of life affirming, really. So that's been a positive thing. But I'd rather not go through this to learn that.
Yeah, understandable. What about yourself, John? What do you feel you've learned?
Well, I learned wash your hands more frequently.
Yes, I think everyone has now learned that. Yes.
And actually, wash your hands, gel your hands before you open and close every single door in the hospital, before you go near anybody or touch anything. And I think that's, and also face coverings when you're within 2 meters of people. I think that's become second nature, actually.
Okay.
Yeah, I think we'll all come out of this a lot more germ aware, won't we? Yeah,
and I think other hospital infections have dropped because of this.
Good.
So it's had an impact on other infections as well. There's far less flu as well, not surprisingly.
It's interesting, isn't it? Well, they say, don't they, not all heroes wear capes. And I guess me and Sarah, on behalf of all our listeners, just wanted to say a personal thank you for your continued hard work throughout this pandemic. You really have been our frontline heroes. So, God bless you both for that.
Yeah, I'd like to thank you, but I'd also like to thank all our patients as well. Patients for having the patients, because it's been an incredibly difficult time for many of them. As John said, people have had surgery delayed, and I have to say that we have a very lovely group of patients who have been wonderful through this. And although obviously people have had concerns and contacted us perhaps more than they would at other times, that's no problem at all. But I've just been very impressed about the way that people have just coped with what's been an absolutely terrible year.
It really has for so many, hasn't it? But there is light at the end of the tunnel, as we've heard you say many times as part of our chat today. Thank you for myself and Sarah for agreeing to be our guests and also sharing some really positive news about the future. It's been an absolute pleasure to interview you both today.
We are super excited for the future of With You in Mind episodes because we have some really great guests lined up for you. Join us next time when we'll be interviewing neuropsychologists from the National Hospital, and we'll be looking more into the emotional right side of the brain.
Yeah, give us a follow on all social media platforms where you can hear the latest With You in Mind episodes. In the meantime, stay safe, stay well, and stay tuned.